Biopsy of salivary gland, needle. A needle is inserted through the skin overlying the salivary gland. The physician takes a tissue sample from the gland and withdraws the needle. Biopsy of epididymis, needle. Biopsy of testis, needle. The needle biopsy sheath is advanced over the needle and twisted to shear off the enclosed sample and withdrawn containing the sample from the epididymis or testis. The wound may be closed by suturing. Biopsy of salivary gland, needle. A needle is inserted through the skin overlying the salivary gland. The physician takes a tissue sample from the gland and withdraws the needle. Biopsy, pleura, percutaneous needle. Using a pleural biopsy needle, the physician passes the needle over the top of a rib, punctures through the chest tissues between two ribs, enters the pleural cavity and slightly punctures the surface of the lung. With the end of the needle in the chest cavity, the physician withdraws a piece of tissue. The needle is withdrawn and the puncture site covered with a bandage. The procedure is often done under radiological guidance to assure more precise placement of the needle. Biopsy, abdominal or retroperitoneal mass, percutaneous needle. Using radiological supervision, the physician locates the mass within or immediately outside the peritoneal lining of the abdominal cavity. A biopsy needle is passed into the mass, a tissue sample is removed, and the needle is withdrawn. This may be repeated several times. No incision is necessary. Biopsy of pancreas, percutaneous needle. The physician removes tissue from the pancreas. The physician passes the biopsy needle through the skin of the upper abdomen under CT guidance. Biopsy of liver, needle, percutaneous. When done for indicated purpose at time of other major procedure, the physician uses ultrasound guidance to place a hollow bore needle between the ribs on the patient's right side. Biopsy of spinal cord, percutaneous needle. The patient is placed in a spinal tap position. The affected vertebrae are located and local anesthesia is administered. A biopsy needle is inserted.